Hi, everyone, and welcome. My name is Ana Santiago, and I'm a Master of Social Work candidate at Arizona State University. Today, I'll be presenting a financial wellness and health equity support group for BIPOC women living with HIV. So first, we're going to dive into the community need. So let's take a look at some of the statistics here. Women make up about 19% of new HIV diagnoses. However, when we take a closer look, there are clear racial disparities. Here in Arizona, we've seen about 20% increase in new HIV cases, specifically impacting Latino and Hispanic communities. And in Maricopa County, Black residents make up 6% of the population, but account for 16% of new diagnoses. These disparities aren't happening in isolation. They're driven by larger structural factors like poverty, limited access to care, and financial instability. And one of the most important pieces here is that financial instability, financial hardships. Research shows that financial hardship is actually a stronger predictor of medication non adherence than depression or substance use. So that really highlights how closely financial stability and health outcomes are connected. And now we're diving into why a group based approach. This group is designed to address not just HIV care, but also financial and emotional stress that comes with it. It creates a space where participants can feel less isolated and connected with others who share similar experiences, reduces some of that stigma, and build financial skills that support long term stability and ultimately better health outcomes. And now we're going to dive into the theoretical framework and evidence based relevance. This group really addresses a gap we often see in social work, and that's a connection between financial stress and physical health. A lot of the interventions for HIV focus on mental health and medication adherence, which are both very important, but they forget to address how financial hardship is a key factor to both of those. So this is where financial social work comes in. It's an evidence-informed approach that looks at how our financial behaviors are shaped by emotion, stress, and systemic barriers. And then we also bring in somatic regulation, which is informed by somatic experiencing to help participants regulate stress in the body. Because financial stress isn't just something we think about, it's also something that we feel. Next, we're going to dive into the group structure. This is a hybrid psychoeducational and life skills group that runs over 8 weeks with 60-minute sessions. The flow of the group is very intentional. We don't jump straight into budgeting. As you can see, some of the topics that we cover each week. We start with safety. That's because when someone is in a stress response like flight or fight, it's really hard to process information, make decisions, and learn new skills. And financial stress often puts people in that exact state. So you'll see that the first half we focus on financial stress, how it shows up in the body, building tools to stay grounded and regulated. This helps participants move out of that survival mode and actually engage with the practical material. In the second half, we shift to building real world skills like budgeting, goal setting, um, understanding barriers, systems, advocacy, and future planning. And to make sure that the group is actually working, we do incorporate some evaluation and outcomes. So, on the quantitative side, we do a simple pre and post questionnaire to track changes in financial stress, confidence, and emotional response. We also use task achievement scaling each week. And this is where participants can set small, realistic goals and we can track their progress over time. On the qualitative side, we include guided group reflection, and this is where we're documenting changes in emotional regulation and financial behavior. We also incorporate individual participant satisfaction measures. And so these are check-ins to understand their experiences in the group, things like connection, support, and overall impact. And most importantly, we also center lived experiences. Participants reflect on how their ability to manage financial stress evolves, along with living with HIV and how it's improving their overall health. And lastly, today we're going to cover community collaboration. Um, so, when we look at impact, one of the most important things that this group will bring to the community is that health impact. As we mentioned, financial hardship is a key driver to HIV treatment non adherence. So, this group will build stability, reduce stress, and support treatment adherence. At a community level, this group builds on strengths that already exists in BIPOC communities. So that's resilience and mutual support. It also creates a shared understanding that financial struggles are often systemic, not personal. And that shift alone can reduce a lot of the shame and open the door for change. And then we're also bringing in advocacy and navigating skills to navigate those systems, whether that's public benefits, community resources, or barriers. And lastly, this group will have a long term impact. It will increase financial confidence, self efficacy, reduce stress, and again, that improved health engagement, build stronger, more connected, and resource informed community. And that's all that we have for today. Thank you all for taking the time to be here and engage with this work. I'm happy to answer any questions or hear any of your thoughts. Okay, thank you.